I remember the word that was delivered to me by two surgeons, two US surgeons, that if anyone could start this surgery in the world, it cannot be except Feras Khaliel.
Dr. Feras Khaliel, head of the Cardiac Surgery Department at King Faisal Specialist Hospital and Cardiology Center in Riyadh, Saudi Arabia, has performed the world's first fully robotic heart transplant surgery.
I woke up and I said, really, we need to do something about the heart transplant because the complication is too high when you perform the conventional way, which is opening the sternum.
What kind of conundrums or challenges with regards to you trusting a machine to do the operation as opposed to human hands? Generally speaking, what would you say keeps our hearts healthy? What should we do more of? And what should we perhaps do less of?
So there was a patient who is 16 years of age, being hospitalized for 2 weeks on IV drips, medication that stimulates the heart, because without it, he cannot live. Without it, his blood pressure goes down.
Did everything go according to plan, or were there some hiccups along the way? What measures do you feel can be implemented to ensure that prescribing practices are done when a patient actually needs it and not for the sake of corporate profits?
Less potassium in the body, less calcium in the body can aggravate ectopics, can aggravate even benign palpitation, which is the atrial fibrillation. So banana, dates has potassium in it. And I think if we balance our nutrition per day, even 1 date a day, 2 dates a day, 1 banana a day, can eliminate that factor.
Doctor, this can easily turn into a consultation. And I'm about to ask you what your hourly rate is. Just want to make sure that... We are. Thank you, though, Doctor, for many things, for putting me at ease right now as I open up about what I've been through over the past few weeks. Thank you so much for coming to Jeddah to come on the show. I wouldn't have been excited, and I was telling this to Faisal, our show manager. I had to cancel a few trips to Riyadh. I couldn't really live my life as usual over the past 3 weeks because of the spike in my skips due to having 1 too many coffees, which I'm proud to say that I quit 3 weeks ago. But to leave my house and to come shoot an episode, I wouldn't want to do it with anyone else besides arguably the best heart doctor in Saudi Arabia, one who is now famous for leading Saudi Arabia's first robotic heart transplant. Dr. Khaliel, thank you so much for spending the next couple of hours with me so we can get to know your story and everything that you've been up to.
At an altitude of 37,000 feet, we soar, with a rich legacy of honoring our guests, and a unique style that has resonated with the world for 78 years. We carry the name of our country on every journey and across every sky. We are Saudi. We welcome you in our own way. We shape our present and build our future. Saudia, our name and country, our style and approach, striving for excellence in everything we do. This is how we fly.
Thank you very much, Muhammad, for your invitation. Honestly, it's a huge honor being here, watching your episodes that you have conducted for the past year and 2 years. and how it has progressed, for being here in new location that you have acquired. Honestly, I'm very proud of your show and the success, and for us to be discussing this world's first success that we have conducted in Saudi Arabia.
It's an amazing story. I was scrolling through Instagram a couple of weeks ago, and this page with a couple million followers called Wealth had a beautiful post. We'll put it up on the screen right now if you're watching on YouTube. And it said Saudi Arabia conducts first robotic heart transplant. And it was the first time ever where I go into the comments and there wasn't a single negative thing about the country. You know, in the sports world, if it's Ronaldo scores his 900th goal, you'll get negative comments of Saudi. But the globe was clapping for us. And it's such a surreal moment that here we are a few weeks later, the person who was the mastermind behind it, obviously your team as well, is sitting right across from me. That's quite an achievement, Doctor.
Alhamdulillah. One of many, inshallah, bi'idhnillah, for us and for our country to continue and succeeding and achieving.
Going into something that is controlled by robots or AI, what kind of, I'm sure a lot of challenges came, but is there one that you really stressed on the most in terms of conundrums or challenges with regards to you trusting a machine to do the operation as opposed to human hands?
For the robot, we always test the technology, and we don't start testing it on human beings. We start testing it on dummies even. They call it a dry lab. And then we move into a wet lab. So it could be just a piece of organ or a cadaver, where we conduct all these surgery and performing them with high accuracy and taping it, recording that, going back again later on and reviewing every movement and whether we or not we have conducted something that was a margin of error higher than the usual. It's a tool. It's a very high accurate tool that we're utilizing for the past 20 years, and it showed its reliability.
Did everything go according to plan, or were there some hiccups along the way?
With the first
robot, yeah.
So everything went on according to the plan. This, when it started by, you wake up in the morning, you're full of energy, and this is exactly what happened to me. And I was on holidays.
Cortisol is high.
Correct. So what happened is I woke up and I said, really, we need to do something about the heart transplants, because the complication is too high when you perform the conventional way, which is opening the sternum. And we need to improve the quality of life of the patient, hence lowering his hospital length of stay, ICU length of stay, complications, side events. And I started thinking, how can we conduct it without opening the sternum? Should we go from both sides, right and left thoracotomy? Should we go subxiphoidal, which is right under the sternum, avoiding the bone? Or should we go from one side? Each one, you have to put the time factor. In heart transplants, you have to be quick. From the moment you remove the heart, the good heart, the donor heart, until the moment you implant it and start function, this should be 4 hours, not more. Sometimes, in rare occasion, we can reach into 5 hours or 5.5 hours. But you should remain with the guidelines, which tells you 4 hours. Now, if you perform surgery, every single anastomosis to attach the heart, anastomosis, basically suturing a chamber to the recipient, that takes time, and you have to time that and make sure that you do not pass the specific time that you need per suture, per anastomosis, per chamber. And that's what we have done. So after I've written the theories, from entering the patient, I start putting down all the points, mapping where I would go, where are the robotic arms be, and what's each next step that's also going to be. I finished with that. Then I moved to the type of suture. I chose that. Then I moved to the type of instruments that I need. And if it is accessible, if it is there or not, because it has never been conducted before. And once I have chosen different types of sutures and instruments and have written all the choreography and the planning, the schematic for the patient, I was drawing even. I called my assistant, who usually come with me in the robotic cardiac surgeries, whether it is valve or bypass. And we sat down and with high confidentiality, we discussed deeply about this. Then, and exactly what he has to do, because he has to be next to the table, which is next to the patient, handling me the tools and the threads. And I'm the one doing the motion at the console. And I'm the one who has to be conscious about the time, conscious about the communication between the whole team in the OR, because you have 10 people in the OR. You have anesthesiologist, you have perfusionist, you have nursing at bedside, nursing floating, you have the anesthesia tech, the assistant surgeon, the second assistant surgeon.
It's a football team.
So it's the whole team where you have to communicate beautifully in a comfortable environment without raising your voice. And everyone has to conduct it. It's like a maestro. It's like an orchestra.
Mm-hmm.
You have to conduct it in a very nice way, smooth way, but with efficiency and making sure everyone knows their step and my step. So after I've discussed it with my assistant, I went to my chief executive officer. And I spoke to him that these are my plans. And the reason I reached there, because I have performed a lot of high-risk procedures with high success and procedures that's not being conducted worldwide. So, and we have initiated many procedures that hasn't been conducted elsewhere with high success. So he really encouraged it and trusted our technique. Then we had to conduct a high level of meeting, which is an executive committee meeting, having research advisors and academic and training affairs chief with us, senior cardiologists, senior cardiac surgeons, leaders from King Faisal, and a couple of my friends who are senior robotic cardiac surgeons outside. And they had to, over 40 minutes almost, I had to present the whole thing. And of course, with no disclosure to it, even to the surgeons we invited. So it's under high confidentiality. And also the safety net. You're conducting a new technique. You have to ensure safety and efficacy for it. You want to ensure that you're not going to pass the 4-hour time that you could do in convention. So you should beat the conventional. That's the aim. Otherwise, it defeats the purpose. And once I finished my presentation, and once they asked me for every single detail question, step by step, and then they asked me, what's my safety net? What can I do to prevent any harm to the patient? I have answered everything. They asked me to leave the room, and they have discussed the 7 of them of the decision for this. Once the decision came out, which is very positive to encourage, I remember the word that was delivered to me by 2 surgeons, 2 U.S. surgeons, that if anyone could start this surgery in the world, it cannot be except Feras Khaliel.
الأفضل على الإطلاق، نكهة قوية، قرمشة مثالية.
So I'm like, okay, I'm glad that people have this high level of trust. My colleagues from the US and, elsewhere, even at King Faisal. So that put a lot of encouragement. And we started in our research center. So we started with a simulation. Then we started taking that into the working on a dummy, then working on cadaveric. And we have conducted it over 7 times. So the first 4 times is to drop down the time of full transplant, because I want to compete with the conventional. When I dropped it to that time and even less, I conducted it 3 more times just to see, okay, I'm comfortable, I'm happy. I remember the first time my assistant was really concerned because it wasn't easy, it was difficult. The second time, he completely changed his mind. And it was because of the tissue, the cadaveric, it was a bit deteriorated. So, and we were pushing it every time, and staying up late. So we used to start at 7, 8 in the morning, working in the lab, finishing around 6, 7 p.m. So we were working 12 hours every single day for 5 days and living basically down there. And we were excited because the results every time is even better. And not only that, we have conducted other stuff, which soon I'll be releasing, inshallah. So afterwards, we basically start to allocate patients who can be, because you have to put inclusion criteria, exclusion criteria. So there was a patient who is 16 years of age, being hospitalized for 2 weeks on IV drips, medication that stimulates the heart, because without it, he cannot live. Without it, his blood pressure goes down. Without it, his heart rate goes down. Without it, the end organs start to fail, such as kidney, liver, because all depends on the heart. So he was stuck in the hospital, bedridden, on IV drips, awaiting heart transplant. And he was a young chap. And he was so fearful of many factors. But one of it is having his chest open. The other one is having a heart transplant.
All of a sudden, my ectopic seemed like a very small problem. Skeen, how did it end with the 16-year-old?
He's perfect.
Alhamdulillah.
Alhamdulillah, he's perfect. Now it's, we conducted the surgery on September 9th. So now we're October 16th. It's 5 weeks. He is amazing. And
out of the hospital?
Of course, yeah. He stayed only 14 days in the hospital. Versus, we looked at our number for patients who underwent heart transplant in year 2023. And the average length of stay is 64 days post-heart transplant. This kid stayed only 14 days. And it tells you what the technique did to him. بإرادة ربنا عز وجل. الحمد لله. هذا النجاح اللي احنا we really wanted to see. We really wanted to transfer this to every single patient. We really want to lessen the pain for the patient. Because sternotomy is not something light.
Okay.
And with all the possibility of complication that can happen with bleeding and infection, especially, this heart transplant patient or organ transplanted patient, they all go under immunosuppressant. What does that mean? It means you lower the immune system. So they're prone to infection. They're higher than you and I to develop infection. Now, if you have this huge incision, 25 centimeter, in the chest with bone cracking, it takes 3 months to heal the bone. Any bone fracture, and this is a fracture, so it takes 3 months. But for post-transplanted patient, it takes even longer because the healing process is less.
So to get into the body, you are purposely fractioning the bone.
Correct. You have to open from the top of the front bone till the bottom. You open the skin, then with the saw, you open the whole thing.
That's how you get into the
spread the chest.
rib cage or the chest, yeah.
And spreading the chest cause a lot of pain on the back as well, because it's a lot of pressure when you spread. You open up because the heart is in the middle. You need to open up 15, 18 centimeter in order to work with your hands.
Is that by definition open heart surgery?
That's by definition the conventional sterline. You can still do open heart surgery via robots, which is what we're doing. But you eliminate by the robots all this chest cracking, lifting, etc.
So it's not just a cool, funky statement. It's actually more efficient in many verticals.
It is. That's why it took us a few weeks to almost, as a matter of fact, 2 months to write down the possibility, the theories, the steps, what possibilities that can happen, positive and negative, and how can you come out of it? Because the end game is patient survival and improving quality of life. You can never compromise that. And that's what we look for. But it's worth it to dig deep. It's worth it the many hours per day working, 14 hours a day in the lab to perfect the greatest module in conducting such procedure in a patient with the least morbidity, which is the least side effect that you can cause the patient.
And the Mr. 16-year-old, he was the first patient that had the robot operated on him?
Correct. He was excited, but he's 16 years old. According to our country, 14 and above is an adult, or lies under the adult section. But we did have to speak to his siblings, older siblings, and his parents, and consent to all of them, the patient and his parents, for the procedure. Everyone supported to that. Even our team, the cardiologist, the nursing, the anesthesia, and the surgeons were all supportive to proceed. And I think it's, we have been doing that for 5 years now, robotic cardiac surgery, and the program has opened since that time. Our success rate is very high, despite the fact we take a lot of high-risk cases that pretty much no one in the world does. To reach fifth redo sternotomy, patient who undergoes 5 times open heart surgeries over a period of 10, 15, 20, 30 years, 40 years, we still accept them for their 5th or 6th time to be via robotic. When you look at the star hospitals that leads the hospital in the world, they don't conduct that. And they have advanced robotic program, robotic cardiac surgery program, yet they don't. And I think it's King Faisal has been harnessing really the highest risk patients. So we all are used to treating this kind of category and got us into all preparation needed with higher safety and efficacy.
What a story. When you hear of your colleagues that say you are the best at what you do you ever pause to celebrate that moment?
Wow.
We're going off piste here.
Good question. I never thought of it.
Do you ever tap yourself on the back and say,
No, it's a beautiful question. And it reminded me when people were saying, wow, you must celebrate now. When I was in New York, And I just finished Davos medical meeting. Everyone was really proud, and they're so excited to celebrate. I was, of course, joyful and thankful to God for the success we have harvested at our country and at our hospital, and with this patient. But the responsibility, the thoughts. What is next? When is my next patient? How many patients can I conduct per year? And how can I expand the program further? Because I saw the great smile and joy of not only the patient, of all his family, of my colleagues who witnessed. And you ask yourself, is like, if I pushed the bar so high with a heart transplant, which is the crown of all cardiac surgery and all surgical procedures in the world, the heart is the most important organ.
Absolutely.
And if you push that, then you can push for all the rest of cardiac surgeries. And it got me thinking of, okay, we have done that already, check. And we have 3-4 other surgical procedures that we will going to do. But, the most joyful time is when, to share this success is when you are at home and sharing it with family, honestly, and best friends.
Yeah. Must feel good. As that night when you went home after performing it and it was successful.
That night, when I went home, because it was overnight, so I only slept for a couple of hours. I wanted to be awake. I wanted to watch the patient. So, but all my colleagues were extremely happy that it succeeded. Even a lot of them didn't know, because this was conducted under high confidentiality. But they kept calling and congratulating. And I was just around the patient, roaming around, making sure that he's doing fine, waiting impatiently to have him waking up and extubated, removing the mechanical ventilation. When that happened is when I really calmed down. When I saw him mobile and talking, and all the parameters were perfect. His vital signs, his heart rate, his blood pressure, his blood investigation, his echocardiography, which is a heart ultrasound showing good function. There, I was really happy. And I said, now it is the time to celebrate.
You waited for him to settle.
Correct.
You hear about burnout, and if it's bankers who are burning out or engineers who are burning out, I don't really subscribe or worry too much about them burning out, but I do when it comes to doctors. Do you ever experience burnout? Do you ever feel that it's time to maybe take a step back, go on holiday after a surgery like that? Is it on to the next one, or do you think to yourself it's time to go to one of the islands in Red Sea?
It's a very important question. They always say that training for cardiac surgery is exactly like military training. And I remember in the first year of residency, and the residency program, which is a training program, lasts between 6 to 9 years.
Wow.
They used to advise us, eat when you can, sleep when you can, because you never know when is the next surgery and how long it's going to take. Could take 24 hours, take longer than that. So I believe somehow we are trained to work long hours with high focus. But at the same time, we are trained to say, stop, I cannot do it. I need to rest. And we do. And honestly, our vacation usually in general is scheduled. But there is at least 30% of that annual leave, holidays, it's not scheduled. A colleague of mine would come to me and says, I'm taking off next week. I'm taking off starting from today. I would never question as a head section. I would never question that. Perfect. We'll cover. You don't even ask. Because this is a very high demanding job. You're sure about their hard work. They need to leave, they leave. Even if they don't need to leave their city, which is Riyadh. Just the fact that they stay home, meditate, R&R, is enough. So as much as we're trained to perform and conduct excellent procedures with high skills for all our surgeons, is as we do know our limitation, where we have to slow down or we have to stop. Whether you stop for 3 days or 2 weeks or 3 weeks, doesn't matter. Sometimes 5 weeks, you take holidays.
It's very important that you, of all people, and when I say you, I mean you doctors, get your rest, because it's very important that we have you as close to 100% as possible.
Well, you know what? You're totally right. But you know what? There's a cardiac surgeon who, as a matter of fact, we studied together in Montreal. And he experienced a burnout. And he has written a book of burnout in cardiac surgery. So it is not something rare. It is happening because there are a lot of patients that's coming who are for cardiac surgery who are very high risk. Cases are becoming very difficult. If you are operating constantly without rest, if you have a disturbed home, if you have pressure outside the hospital, if you have pressure inside the hospital, not related to surgery, but to other reasons. Could be colleagues, could be a toxic environment, could be unhealthy leaders, it could be lack of resources. Many reasons that really can push you for stress, further stress, burnout, which what happened with him. Sadly.
Generally speaking, what would you say keeps our hearts healthy? What should we do more of? And what should we perhaps do less of?
I think every person has to look at himself or herself. You start with yourself. Of course, there are many variables and factors. I can endlessly start with sports, happy life, holidays, excellent nutrition, avoiding toxins such as, caffeine, nicotine, and alcohol, and obesity.
Sugar as well.
Of course, sugar and salt are really an enemy of the heart.
Salt as well, huh?
Salt as well. So there is always a substitution for all these things. You can replace them. Salt is with lemon. Sugar is with honey. Could be sweet and low. So there are many other ingredients that's healthier. But I believe it's also within us. I believe also it's the psyche. You really need to take care of yourself. You need to think of, we spoke earlier about slow breathing. The stress elimination factors. Deep breathing slowly and getting out. It's part of yoga. It's part of meditation. And these are facts we need to have. Myself, I wake up every day at 4 a.m. I'm an early bird. I sleep early.
That's early.
Yeah. But I wake up early. And the reason I do is I love to meditate. It's the most joyful time in my day when I wake up before sunrise, before al-Fajr. Well, atilif nafsi, I'm just alone with myself. I can do whatever I want. I can pray. I can meditate. I can also read journals, medical journals, can listen to music. I can watch an episode of Friends. So it's all soothing. until you start slowly with your coffee, with your morning daily activities. You could swim. Sometimes I go down and swim in the winter. And then you start the day. So whatever it takes to really listen the stressful events.
جديد. اكسر الروتين مع أطباقنا الجديدة من بيتزا هات جدة. بيتزا هات جدة، ذوق طعم الثقة معنا.
Meditation has become very popular over the past couple of years. And a lot of people practice it to extinguish anxiety. Anxiety can often be misconstrued for heart issues. I speak from experience. How much has meditation changed your life or had an effect on your life?
I was asked that question just recently. What do you need and how many times do you meditate and for how long? First of all, we really have to define meditation. And meditation doesn't need to be, sitting like a yoga and just thinking of nothing or...
Yeah.
It's much simpler than this.
How do you meditate?
I just don't think of anything. At whether a quiet environment or it is a noisy environment, I still couldn't block the noise. It is meditation, in my definition, is just not thinking of anything, relaxing your mind, trying not to put it in dormant state, but trying not to think, not to worry about an appointment, deadline, submission of that paper, replying that message, doing this, calling that. It's totally disconnecting, and it could be down to even a minute. I do it between my surgeries. I conduct 2 surgeries, sometimes 3 surgeries a day. Each surgery takes 6-7 hours. In between these surgeries, I have a lot of meetings. And sometimes I'm enough. I'm done. I really need time for myself. So I just get inside my office, lock the door, few minutes where I can just shut down a little bit, try to, as much as possible, lower down the adrenaline level in my body, because adrenaline is responsible for high blood pressure and heart rate and sweating, etc., and anxiety. You just lower it down and think positive. I sometimes promise myself a trip. I put it on, okay, it's, an incentive for myself. Because I have done this and that and achieved this and that, I'm going to go to X place for 3 days where I can chill. And usually it's the sea. Usually I'm a swimmer, I'm a diver, so that's my favorite, passionate hobby that I do. And not necessarily I do it. Not necessarily I reach that date. I always push it further. But the fact that you think positive, it drops down all these negativity. And that's meditation, in my definition at least.
It's a complicated thing, mental health. It can make you feel that something is wrong with you physically when it's your mind, it's your monkey mind playing games on you.
Oh, you're talking about hypochondriasis.
Yeah, I might be knocking on that door.
Well, sometimes when we listen to people or to news and about certain diseases, we start thinking that, oh, we do have this. Oh, these symptoms I have experienced that. I most probably have this. And that's hypochondriac.
Yeah. Dr. Google.
It is. Yeah, exactly. So that's part of an anxiety. And that's dwelling on something, it's fictitious and fictitious.
Yeah.
It's not even there. But if you're really worried, book an appointment with a doctor, a specific doctor for that subspecialty where he can diagnose or not diagnose, exclude or include. If it is there, he treats you. So you move on. You're not going to, again, think about it. And if it is not there, then it's not there. Then you should never go back and think you have it or not. And that's sort of an anxiety.
Yeah. Close that door.
Absolutely.
It's being in this repetitive loop where am I not, that can affect many people, not knowing whether you have something that is wrong with you. And even if the doctor says you're good, you go back to your daily life and routine and realize that maybe there is something wrong with me. The mind is a very powerful thing.
Yeah, but hold on a second. If we know or not know, you just mentioned that. So if we continue to stay in that state of mind, which is I know or I don't know, maybe I have, maybe I don't have, this is a gray zone. Whose fault is this?
Patient.
It's a patient's fault.
Yeah.
Or the person. He might not be a patient.
Yeah.
It's a person's fault.
Yeah.
Because he did not seek advice.
Correct.
And help. Probably he just heard from it from a friend or a colleague or someone or a newspaper or social media.
Mm-hmm.
And I think once he goes and reach out to help, not only he's going to get an answer, but he's going to lower down that anxiety of thinking every single disease that's mentioned, it's at his body and system.
It is. You've been part of over 200 medical congresses and published numerous papers. What's one most critical piece of research that you've done that shifted your thinking approach to the world of surgery, would you say?
So there are quite a few that I have done and that colleagues have done. You start with the heart transplant. When it was done 60 years ago, that has shifted all medicine and until today. But most recently, the improvement of medication that's increased longevity of the heart, of the transplanted heart to survive. Furthermore, in robotics, I'm a big fan of heart failure program, but I'm also a big fan of robotics. And robotics, innovation is unbelievably beautiful because it does take the pain away from the patient. And under pain, there are so many sectors between less blood transfusion, less infection, less hospital stay, faster recovery and satisfaction. But also, you can expand that. And honestly, with us is we started, we were the second center to start robotic AVR in the world, but we were the first center to go for triple valves in addition to closing a hole in the heart, in addition to ablating atrial fibrillation to get rid of atrial fibrillation. So 5 things in one. And we've done it at King Faisal.
Is that what the ablation is?
Ablation is to stop any palpitation due to atrial fibrillation.
Is that considered open heart?
So yes, there are 2 types of ablation, but the most efficient ablation is an open heart. So basically, you take the patient to OR and you can conduct it, but it's fast recovering. It's 3 days in the hospital, you're out. And you ensure above 96% that you will not have that again.
The ectopics or the AFib?
AFib.
But do people do it for ectopics? Asking for a friend.
Ectopics basically mainly is the medication. There are ablation for ectopics, but when it goes pathological, which is mainly 300, 400 ectopics per day, they have ablation. And there is a department called electrophysiology. It's percutaneous, it's not an open heart. Percutaneously, they can target these foci, they call it, or foci, which is in the heart somewhere. It could be due to many things. One of it is scarring. So they go there, they ablate it to get rid of that focus. Foci, it's from focus. A focus that send these ectopics every now and then.
So if you get 300 or 400 a day, you should get an ablation.
Well, not necessarily, because it is an escalated management. So first of all, you diagnose. Second, you need to eliminate the risk factors, which we talked about, the stress, the smoking, etc. Third is beta blocker. And fourth escalating to calcium channel blocker, which is another type of medication that blocks certain things to slow down the heart rate. And then first could be that patient use.
I think I'm going to have to take an appointment with you, doctor, because I'm going off piste here and asking you questions related to my situation.
Anytime, and I'll direct you
Yeah,
to the proper management.
Thank you. I'm just happy to know that the frequency of mine are reducing per day.
But Mohammed, I'm seriously not worried about you.
Okay, thank you.
Because we've been talking for the past hour, we got excited for the place, and I've given you some news about the patient, how it is, and it is emotional.
Yeah.
And you did not even sweat. You did not breathe fast because I'm watching you. And
I got a few ectopics.
yeah,
Yeah.
possibly, yes.
Yeah.
But part of it is normal.
Like
So
sweating is part of something that you would see as a red flag.
sweating is part of something that you can see as a red flag. It comes. Just to close it, definitely you're more than welcome to come to the clinic, and I'll run a battery of tests
Please.
to make sure that you're perfectly
Stress tests, ultrasound, ECG,
everything.
I know the-
Holter.
Yeah.
Absolutely.
Great. Back to the show.
Yeah.
When it comes to time management, how do you split your time between, what you do in the OR, as well as you being a professor at Faisal University, as well as family? Do you find that splitting your time amongst those three areas challenging, or does it come naturally to you?
Honestly, it comes naturally. The reason I don't want to be perfectionist, but of course, in the beginning of my career, it was challenging because you try to do everything. You're jumping everywhere. You want to be in the hospital all the time. You ignore family, but with time, you learn and you mature, and you try to balance life, as much as you can. And this comes not within you only, but the advice of the elders, whether the elders in your family or even in your colleagues. But looking at being a professor and being a surgeon, I started this career in the beginning of my residency program, where I was doing my residency, which is my clinical work training, and at the same time at night and in the weekends and my annual leave, I used to take it for doing data collection archive for my master's, for my PhD thesis and dissertation. So I went to the academic and to the clinic. The joy of teaching is as joyful as conducting surgery. Really beautiful, because it's a legacy. Because we are trained to do that as work. You have to make sure the sustainability, the generation is going to continue with perfection and to become even better than who you are, because you're one source to them. You know a lot, but you're one source, and they're going to get it from so many. And teaching doesn't really contradict with the surgery, because sometimes we teach during our performance. In the morning round, we teach bedside when we visit the patient. In the clinic, we teach as well and ask questions and quizzes. In the operating room, we ask questions. And what's next? What would you do? Where's next? Where is this stitch should go, and what should you avoid? And take over.
Yeah.
You tell them, come in, and you observe every stitch. And they should not compromise the surgical skills, neither the time. They have to be as fast. How they reach there? Because we go with them to the simulation lab, which is our dry lab and wet lab for animals. And we stand with them. And end of the days, they conducted on animals, and they start practicing faster and faster the suturing. So I think it's the crowning for your career to have legacy by having people who are trained under your program and under your supervision. And the most beautiful thing, if they surpass you even, it's exactly like raising a child,
Student becomes the master.
Student becomes master in this. It's beautiful.
In the US, you have a pill for everything. You have big pharma, and you have doctors that send patients to medicine, and that profits big pharma. What measures do you feel can be implemented to ensure that prescribing practices are done when a patient actually needs it and not for the sake of corporate profits?
First of all, you really need to avoid over-counter medication. So easy accessibility to a drug. Second thing is observing the clinicians who prescribe. So what Saudi Arabia has done, and Ministry of Health, is they implemented that via the Saudi Commission for Health Specialty, the Saudi FDA. All the pharmacies are not allowed to give anyone a medication because they went and to buy it. You have to have a prescription. And in our hospital, the prescriber, which is the physician, the clinician, should prescribe a medication which is under his jurisdiction, meaning his knowledge, so his subspecialty. So a heart doctor will give the prescription of the beta blocker, which lower the heart rate and blah. But it's not going to be a dermatologist who's prescribing that. But the heart doctor is not going to prescribe a cortisol cream. It's the dermatologist. And that's implemented already, alhamdulillah. So you really need an authority, a health authority, to implement that and stop. You're totally right. The problem with narcotics, over prescription in the States, it's still until today, but we don't have this here.
It's a pill for everything in the States.
Correct. And they have addressed it. They have dropped it down, the rate, but it's still there. Until people got addicted to it. But in here, no. Here, everything is watched, observed. And, for example, the narcotics medication that they're giving there for one physician, here it takes 2 subspecialized physicians in pain to prescribe that, in addition to the approval of the clinical pharmacist. It's well controlled, alhamdulillah, because that's really important.
That's huge. What bothers me is that, and you see it, you hear of stories a lot, especially with younger kids, teenagers, where they're being prescribed to Adderall, or I don't know if it's Valium, but they're being prescribed to these drugs where the doctor hasn't even asked them what their diet looks like. How much screen time are you getting a day? What's happening at school? We're very quick to write a piece of paper and go buy this medicine on a global level, than really finding out what is this child putting into their system by way of in their mouth or through their eyes or through their ears.
It's going to bite them. Sooner or later, if that specific country does not have a regulatory authority where it stops this charade, it's going to bite them really bad. Because And you know, it's not going to be very difficult to see that, because you're going to see these students homeless in the street, and walking like a zombie, because they're going to be out of it.
And you just really don't want to hear of a child going to the point of no return at such a young age because they've been over-medicated, and that really ruins their future. Quick to prescribe and less quick to find out what it is they're putting into their system.
That's so true.
Yeah.
That's so sad as well. But one of many.
Yeah. And to think that this is all done out of, corporate greed, really makes it all the more depressing.
You know, one has to ask this question: where are the parents? Where are the caregiver?
Probably on drugs as well.
Probably.
It's a vicious cycle.
So it's a destroyed home. And where is the authority? Where is the school principal? Where is the school teacher? How come they did not notice this and report this? You will never find this here, by the way.
That's amazing.
Arabia, it's going to be really escalated.
That's amazing to hear. See, these kind of stories don't reach mainstream media. When you talk about Saudi Arabia, you hear about the football, you hear about the entertainment, you hear about maybe the oil, you hear about an English podcast called The Mo Show, but you don't hear of the firewalls or the strict rules that MOH has in place, which Ministry of Health has in place, where no, you can't get anything over the counter here. You need a prescription for it. And that really warms my heart, pun intended.
True. There were a lot of people stopped in pharmacies. They thought, and it didn't take a long time. Once they implemented that MOH here in Saudi Arabia, it didn't take a long time for the public, for people who are living in Saudi Arabia, for even citizens, to realize it's no more a free prescription. It's no more over-the-counter drug that you can achieve. And it was immediately conducted, prosecuted, and people followed through.
It's amazing. And you also, from time to time, a couple times a month, you'll hear of narcotic busts or crackdown. Captagon seems to be something that they're constantly catching people on, which
is thankfully that they have increased surveillance for surveillance on these patients or these zombies or these drug addicts or these corrupted to be caught every time they are in these things. And I believe it or not, when His Royal Highness the Crown Prince ordered that to make sure that that drug is going to be eliminated in Saudi Arabia, of course it did drop down the rate of drug exchange, and we in the hospital were ready for the relapse due to lack of the dose. And there were relapses, but I believe a lot of people also were caught, and a lot of people also were treated. And that's the beauty out of it. I hope we continue to have these patients, because I call them patient, they're sick.
Yeah.
It's addiction. I hope that these patients seek medical attention to get rid of whatever addicted medication they're on for drugs.
The drug prevention program does see them as patients as opposed to criminals.
True.
So there has been a transformation over the last decade or two.
True. So, of course, the dealer is a dealer. Dealer has to be prosecuted, no matter what, because he's Robotic Fasad.
Yeah.
He's the corrupt, he's the malignant. So, but an addict is an addict. You can also reach out and give him hope after the treatment, if he gets disciplined, of course.
Yeah.
Just in the end, it's his decision whether he want to live this miserable life and be living in the streets, or whether he want to go back again. And they can always go back again, and they can always succeed, even if they are 1 year out here in the street. They can always come back, get healed, treated, rehab, and then go back to life slowly. And hopefully they do, really.
For those non-Saudis or those people who don't know what we're talking about, it was about a year and a half ago, where there was a nationwide crackdown on any and every drug usage in Saudi. I'm talking checkpoints on every other street. I'm talking raids. It was a nationwide campaign that cleaned up everything.
It did. And it's still doing.
And they're still doing it. Yeah. End of the day, you don't want something to fall in the hands of your child or your friend's child, and you don't know, with influences of friends these days, how easily it could hit home. And campaigns like this really just create a safer society for everyone.
The most important thing is safety. And the country has security and safety. And drugs alter safety, because these people who are really unconscious due to their medication can not only be harmful to themselves, but they're going to be harmful to their neighborhood.
Oh yeah.
To their next door person or friend, to their school, to their work colleagues, and they should be stopped by any means, because safety is the most important element after health, and with education.
Maslow's hierarchy of needs, you have safety and security is at the top of the pyramid.
But this is one of, alhamdulillah, our vision 2030. When you look at it, vibrant society, ambitious cities,
Quality of life.
and quality of life, and increasing all this dreams we were aiming for. You cannot reach there without eliminating all this negativity that affects a society. So it all goes together, honestly, for prosperity for the country.
Mm-hmm. Absolutely. What's the most rewarding aspect of your work as a heart surgeon? We're back to where we started.
So, when I look at my patient and I really see a smile on his, on her self and face, when I see them free of symptoms, complaints, when I see them even later on, a month later in the clinic, with a great quality of life, you really feel you have achieved what you were aiming for and looking for.
It's the reaction, huh?
Of course.
When you saw this.
Oh, yes. It's and this is universal. Whatever, when I worked in France, when I worked in Canada, when I worked in the US, it's the same. It's a human getting back to their normal life. Because health is really, really important to us. And it's reassuring. And it feels that you have succeeded. Yeah. All these heavy work hours, sleepless nights, it just goes away. You don't feel it. You don't feel the pain anymore, honestly, because that's a fruitful outcome.
Makes it all worth it for you.
Does.
But someone who is considering heart surgery, right off the surface, what advice would you have for that person who is considering whether they should have or should not have heart surgery? I know it's a very vague question.
So, okay, I think it's a question that divides into many arms. So, first of all, if he goes to a cardiologist and a cardiac surgeon and he needs the surgery, then we would advise him for the surgery. We will not advise him to change the quality of life immediately. If it was urgent surgery, I'm not going to tell him, no, go for 3 months and come back after you lost 50 kilograms or 20% of your body. No, if it's urgent, you conduct it. It's elective is something else. You modify your risk factors, which is your lifestyle. You modify your lifestyles, meaning if you're a smoker, you quit. If you're a heavy eater, then you slow down a little bit. If you are into fast food, you switch into nutrition and well diet. So I would give these hints, but I would also immediately cater into the need, which is surgery. And I would tell him the surgery has been excellent once it's done, and we have done our part. The rest is yours. It's not all going to be the surgeon. The rest is yours in terms of modifying your risk factors. If you have diabetes, please have it controlled. If you're a smoker, stop. If you're obese, lose weight. Exercise. Release the stress. Get rid of the stress. Change your lifestyle. Because, yeah, we might have corrected the problem, but if the problem was caused by these risk factors, then it's going to come back again. And at that time, it's going to be very high risk surgery. So the price is going to be very high if you go back again to surgery. And I think they are entitled to know that, and they have to understand how serious it is. I just want to make sure they do understand. And I'll keep it open. And of course, you have to always welcome them with open arms. It's not a blame game here. It's education, basically. Yeah.
You see examples of people not making changes to their lifestyles?
Yeah, we do. We do. And it's terrible. The outcome is terrible. And I'll give a quick question example. A patient, honestly, and I remember him very well, and because he was very young, he was active, was professor, and he didn't have a control on his diabetes, and he didn't have a control on his smoking pattern. He came to us at a very young age, of 42, needing coronary artery bypass for 5 vessels. And when I came in, he had very tight lesions in his arteries. So we couldn't wait for surgery. It has to be done. I smelled smoke. We just stepped out the backyard of the hospital, smoke, and came back. And I spoke to him and I told him, you're going to come back to us if you don't quit. No, I'm going to quit. Don't worry about it. I'm done. That was the last cigarette. We performed surgery. Not even 5 days later, when he left the ICU going to the floor, the nurses smelled cigarettes, but he got out and got in. We counseled him again that it's going to happen because that is a risk factor and you are prone to have coronary artery disease. And whatever we have done to you, which is the bypass we have done, it's not as strong as the native vessel. So it's going to deteriorate fast. Instead of lasting 15 years, these bypass, it's going to last probably 4 years, 5 years. You know, he returned back to us 14 months later. We couldn't do anything because his vessels were eaten up. It's not even possible for a stent, let alone for cardiac surgery, open heart bypass. And you know what's the outcome of that?
It's unbelievable how these cigarette manufacturers have made the chemical so addicting that even when your life is on the line, you still reach for one.
And they got away with the lawsuits. Whatever picture they put on the packs, whatever message they write on the packs, front, behind, back, whatever, different colors, they're still selling.
Strong lobbyists.
And not only that, so many other ways targeting into that, meaning the vape. We don't know anything about the vape. There's just a study came out 3 months ago saying that the vape is even worse than cigarettes because it's chemical and glycerine, and the glycerine and the chemical in the vape goes into the lungs and cause bronchiectasis. What is bronchiectasis? It kills the bronchi inside, الشعب الهوائية. It really kills the cells inside. So at the age of 50 or 60, you're going to start being in need of oxygen, home oxygen. You're not going to be able to walk. And it's just simply sad.
Shisha as well.
It's very heavy. And because the tobacco and shisha is glycerine as well. You know, that's sticky, whatever. Yeah.
I was telling you before we started rolling, I don't know if we were rolling, but a few days ago I was around a couple of smokers and it made my ectopics worse.
It will.
It was unbelievable. I was like, this is because of cigarettes.
Correct.
I probably smoked 3 or 4 cigarettes with them just from secondhand smoke.
Certain. And especially if you got out of it, don't go back again into having passive smoker around you because the trigger is going to be much faster than before. Before there's tolerance.
Yeah.
Because you're around them all the time.
Yeah.
So there's tolerance. You disappeared and then you came back. That's a relapse. So no tolerance. So your heart rate is going to shoot up.
I told myself, no more would I ever tolerate being around a smoker.
Absolutely.
I will put myself first because I struggled for the past 2 days just from that 2-hour evening, which is a long.
Stand up and leave. Just simple.
Yeah.
And you don't need to
No.
tell them, don't smoke.
Yeah.
You don't need to. It's their right, whatever, if it's another place, but it's your right to be there or not.
Yeah.
Just stand up and...
Doctor, when did you know that you wanted to be a heart surgeon or get into the field?
So I wanted to be a heart surgeon when I went to medical school. The first year I was studying for physiology. I loved the heart function. I loved the heart anatomy. There is valves, there is nerves, there is vessels that feeds the heart. There is the muscles, the conduction system. Oh, we're talking about like topic. So the electric fibers. And I loved it. So I knew I want to do something with the heart, whatever it is, because I studied all the other organs, but the heart was specific. And in the third year, when I was a medical student, we started to go into operating room. So we were, the third party who hold this organ or, just hold this, push it on the side or do that. And one of the surgeons told me, you have surgical hands. You do not ignore this. And that surgeon was a bit aggressive and he would never give compliments. So the fact he gave me that compliments, I did pursue. I started to attend more and more. And I knew I had something with my hands because when I was a kid, my family thought I'm going to be an engineer because at the age of 2 and 4, I used to fix the appliances in the house. 2 and 4, yeah. I used to fix stuff in the house. So whether it's fans, whether it is a socket, and I would just play with it, yeah. And so everyone thought I would be an engineer, even myself. My mom's sickness has pushed me more and more into think of medicine because I was a child and I was in a mid-teenage, where I was really worried about her. And I was reading medical journals that my dad used to give me. And slowly he got me in. So I went to medical school at the age of 16 and a half. So I was really a kid. Yeah,
Very young.
Yeah, very young. Graduated not completing 22 years of age. But, and I knew within that time that I'm going to do cardiac surgery. And I never regretted it. Yeah.
Any advice you're glad that you did not listen to?
To family, a lot. To colleagues, a lot, of course. So we tend to listen and we tend to not listen because we're rebel down. So, and we're thinkers. Remember, we don't like to be dictated as well. Thinkers. We need to rebel sometimes. So I cannot be the old-time listeners. Oh, I need to dig. I need to. So yeah, there are, and some of it in research. For instance, I did my PhD in stem cell to total artificial heart transplant. So stem cell basically is you use it. You take cells, could be from the muscle of the leg, and you grow it in collision, which feeds it until it starts beating. Then after you harness all that, you take it and you implant it into the heart. Which heart? The infarcted muscle. The muscle that caused the heart attack due to lack of oxygen, so it died. So you take that and inject it in it. I was told don't go there because we tried that experiment 5 years. So I went there and I did my thesis in it. And yes, you do 5 years of PhD and you go deep dive into that topic, but we didn't reach anywhere. So I didn't listen. I went into that, but now it's working because someone else took the torch and for me, what benefited me is it got me intrigued about heart failure. Because after this heart starts dying or more muscle dies, that's heart failure. And that's where it leads us to needing the heart transplant. And then that where it takes us even to artificial heart, total artificial heart, which also on a specialized that.
And that exists today?
It does. We're doing it.
An artificial heart.
An artificial heart.
That a human can replace his real heart with that and live
Correct.
normally.
We remove the heart and we implant the artificial heart, and we have done it in King Faisal. And we transplanted the patient after a few months or a few years. And the majority of the time is artificial pumps. So on the existed failing heart, you implant a pump to suck from the failed chamber, which is the left ventricle, and to suck out the blood and to push it into the aorta, which is the greatest vessel that distributes the oxygenated blood to the body.
That is fascinating.
Really?
That is nothing short of genius.
And I'm working on something that's going to be a surprise.
Something else, huh?
Yeah.
Full of surprises, doctor. If we can close with this, a message you'd like to give our listeners and viewers, a piece of advice, a bit of wisdom, especially those navigating their early careers / passions, what would it be?
Believe in yourself. When you work hard, إن الله لا يضيع أجر من أحسن عملا. And honestly, use the moment. There is a momentum right now in Saudi Arabia. And we have a visionary leader. We have a godfather who created Vision 2030. We have all the capabilities that our Crown Prince, His Royal Highness Prince Salman, enabled us to giving us all the tools to innovate, to work, to achieve. And I think this is what I would tell them. Work on yourself and work together to reach a target. And every time you reach a target, put a new target and reach it, because we are living in a momentum where we're enabled to conduct all our dreams that will become true. And it will never stop. Honestly, that's what I would say.
I love that. I've said it a few times on the show that we live in a Saudi today that if you work hard enough at something and you're good at it, you will find the country behind you, supporting you in whatever capacity that is, whether it's in sports, whether it's in film, whether it's in medicine. There's something here for everyone.
Absolutely. I have experienced this because our programs, the heart transplants and the robotic, are transformation program. It was put because of Vision 2030. So I have seen the fruitful outcome. I have seen the growth, the faster growth in that over a very short period of time. The Vision 2030 was only put 5 years ago. Look where we are right now.
Yeah.
Look what we have achieved right now, as you mentioned, not only in medicine, not only in the health sector, but talking about the prescribed drugs and over-counter drugs. This was stopped because of this initiative to perfect in every sector. And for us, for myself, to be part of that, I wouldn't leave my hand in a million years, because that's also another legacy that you're going to do and perform for your own country.
Absolutely. How can we follow your work, Doctor, for those who want to stay updated with what you're up to? Is there a website, LinkedIn, something that we can share with the...
I do. So the first thing is to the hospital, of course, King Faisal Special Hospital and Research Center, and we have our websites where they put all our addresses, and you can reach us through that. But easily for everyone around the world, they can reach me through Twitter, which is now X. It's open. They can send me messages. Usually, honestly, I don't answer any message except for a patient who needs help. That's where I always am ready, because it's limited time. But they can always reach me. And Twitter, I keep it for patient. If they want referral, if they want to come over to King Faisal, and I can help them in opening files. If they need surgery, I'll cater to all that, to hasten their recovery and their management treatments. For me, professionally and socially, is LinkedIn. So I have the two, LinkedIn and Twitter X.
Great. Fantastic. Thank you so much, Doctor, for everything that you've done and continue to do. And excited to hear about the things that you haven't told us about yet, but I'm sure it's going to be very exciting. Thank you for putting us on the robotic heart transplant map. You know, again, I go back to that post I saw, and I've never seen a post with comments that were all positive. I think I saw 100 and they were all positive, and that's never the case. We really appreciate all the work that you put in. Clearly, you love what you do, and may we all reach the point in our lives where we all love what we do.
Inshallah. Thank you so much for inviting me and be part of this beautiful show, honestly. And it was great to know you, and I wish you a great sustainability, because now I have subscribed into your show and I'm going to be following you as well.
Yes, you're an alumni now.
Thank you
very much, Doctor. Thank you.
You must well.
Take it out here.
الله يعافيك. والله I loved it. انت عارف انا احكي لك حاجة. انا you know what I love more?